In a lot of cases, the data doesn't exist in these databases, so you have to develop these bespoke studies to be able to get at the data. Is that a fair summary?
We talk about preeclampsia as if it's a condition, but it's multiple conditions. I use a reference called Up to Date, which many clinicians use to provide background information. And when I go in there and I look at the symptoms for diagnosis, and I see that it lists 10 symptoms and says that a patient only has to have 3, that immediately says to me, these patients are going to be heterogeneous with this diagnosis, and they're not all going to be the same because all they had to do was have some 3 of these, and they may not have the same 3. And therefore, they maybe don't have exactly the same condition and need to be considered differently. But that becomes a challenge because we don't have the data to look at that. That's where we come in and try to tease those things apart using different kinds of novel algorithms.